Hi, my name is Dr. Michael Hall, and I'm speaking to you live from Miami Beach, Florida. It is the 27th of July, 2020. I'm here with Sophia, who's my faithful assistant during these trying times. We live in the current COVID pandemic, and we're in the epicenter in Miami Beach, Florida, which is really technically probably not the epicenter. We probably are having more of it surrounding in the southern part of Miami itself, because there are quite a few day laborers and folks that have come up from Latin America and Mexico, believe it or not, working in Homestead. It seems to be that that population is being more affected, and also the immigrant population in and around Miami itself that are Latin seem to be at higher risk for COVID-19, and that is because a number of things, but one is that they have more of the ACE2 receptor expression in their lungs, and that will cause a greater response of the inflammatory system in the body in the relationship with the infection. So we know that the ACE2 receptor, which is in the brain, the lungs, the kidney, and the testes, those areas seem to be affected, and also the heart for some reason. And we're not sure if the heart is solely because of the ACE2 receptor expression, or that there's another receptor that the virus triggers or attaches to a cell that then causes damage to the heart. But that seems to be more and more common that we're hearing about from researchers. But anyway, I did have a little bit of experience since March with the infections, not a lot. I personally don't see the patients in my office because we're forbidden to have patients in the building who are sick. So we have sent our team of nurses to people's homes to do screening, blood tests, IVs, and just general treatment, which seems to be going pretty well. Our nurse, Bertha, will go to our patient's home and will be able to provide in-suite care. And we do that with regard to folks that we suspect COVID, that do have COVID, or that have other issues that we just are not sure about. But we use telemedicine. We use an EMR that has the componentry in it to do communications through email and e-scripting, so that we can send prescriptions directly to the pharmacy without actually even having to write them by hand, which is nice. So that's a new thing for us. And we also realize that much of what's being said in the press doesn't seem to be really based on any guidance. We know that to be true because we're not hearing that folks should be taking vitamins and minerals, trace elements, and I think that's super important. Part of my practice revolves around integrative functional medicine, which simply put is kind of holistic in nature. We look at the patient from a much higher level of thinking, in the sense that there are multiple organ systems that are constantly challenged by their environment, and we know that food and diet has a huge impact on health. We also understand the epigenetics of the person's environment: stress, alcohol, tobacco use, drug use, pharmaceuticals. These all have an impact on health and wellness, so we try to mitigate any risk patients may have through better living. And that may seem like common sense, but for most people, they seem to not tie those ideas together very clearly, and they have to be explained, especially when there's so much stress in our environment. So that's one good way of looking at this, if you will, is from a perspective of health integration and functionality. And if we understand that, say, someone in a nursing home may be at risk, it makes sense, right? They're not doing so well already. They're pretty old and they may have underlying conditions. They need to be fortified with vitamins, minerals, and trace elements. Zinc being a trace element that probably most people are deficient in, just because it's not in our environment so readily. And we do have nutrient deficient foods that we are consuming every day, which means that they're not grown in soil that has nutrients that we need, so that they're grown in hydroponically, or they're grown in soil that just is deficient. That food then feeds our immune system. And if we don't have that, then we can't fight disease. And that goes for vitamin C and vitamin D. Vitamin C and vitamin D are essential for the immune system, and it's an everyday kind of thing. You just don't take that once in a while. It's a daily consumptive need. So those are things that are important, and we can talk about that later. Today has just been really trying to get the word out that we are the Dr. Truth Show. We're based in Miami. We are really trying to take health and wellness to a completely different level and cut through disinformation, misinformation, and just outright lies. And I think there's a lot of that going on, regardless if it's the fake news and it's the CNN platform all the way down to the mom and pop podcast in Ohio or wherever. These people that we listen to at the government level all the way down to the local level, friends and family, nobody seems to really have a good handle on what's going on. And not to say that we have everything that you're going to need, but we do know what we're talking about. And we do this from a perspective of health and wellness. And we are bona fide clinical practitioners that have real degrees that are board certified. And we're doing this not from a place of fear and loathing, but really from a place of strength and logic. We don't want to make fear porn part of our program. We're not about that. We're about coming up with solutions and new ideas to address health. So, of course, this is the number one health issue of our day. Then from that perspective, we can jump to other things, including everything from anti-aging and preventative medicine to things that are important to us from a different perspective. Could it be trying to have a baby and fertility concerns, trying to stay vital and healthy in the later years? All of these things do make a difference, and we can talk about that. So that's our strategy here. There are many topics that we can go into, but for today, really the goal was to introduce who we are and what we want to convey. I think that we're a new breed of podcasters. We don't really have any desire to have advertisers or any lobbying groups. We don't care for pharmaceutical companies. We don't care for anything that's not really wholesome and truth-backed. We really want to project out to people real information. So that's going to be our moniker. And obviously, the Dr. Truth Show more or less states that. The other thing is I am a physician who has been involved with health and wellness now for over 15 years in Miami, and my clinic in Miami Beach has been functional and active since 2006. I've been a doctor since 1994. I have two backgrounds, one in ophthalmology, one in family medicine. I've done two fellowships, one in integrative functional medicine, one in acupuncture. So my background is pretty diverse, and I try to offer multiple avenues of thinking when it comes to taking advantage of the newer technologies that are available for people, especially now, that want to know about their genetics, that want to know about their different health systems. Could it be maybe that people are more proactive or they're just more concerned? I don't know, but people really want to take better care of themselves. And this is a great moment in time for people in America to really refocus and double their efforts on trying to maintain better diets, better workout schedules. Obviously, we know that there's an obesity epidemic in America. There is an anxiety epidemic. There is depression and more of a disconnect now going on because people are not associating with each other. So loneliness is becoming a top priority in health because of the fact that we're separated from one another for multiple reasons. Technology, the COVID, just really all these things at once. It's a perfect storm of social unrest. And obviously with all the rioting going on throughout the country, there's uncertainty. We don't know what it's going to look like in a few months during the election. So that being said, we'd really want to drill down into things that are important. So as we go through the next few weeks, as we go through settling in here on our podcast, we want to take questions and we'd love to have feedback. So I'm going to let our podcast end now. Unfortunately, I think that's enough for today, but we'll be back with more. And Sophia will be always around to take questions and be able to bring those questions to me. So you can email us at clinic@halllongevity.com. clinic@halllongevity with two L's, HALLONGEVITY.com. You can reach us there, or if you have any questions directly for me, you can contact me at 305-672-4733, 305-672-4733. That is the clinic's phone number, and you can always reach us that way and leave a message, or I will pick up, or Sophia, or Maylene. So we hope you have a very safe and productive week. This is Monday, so we're going to sign off.